Any other comments on this amendment? If not, I will turn to the Senator Smith.
Thank you, Madam Chair. I'd like to offer my amendment, Smith number 2, with Senator Murkowski. This is an amendment to Section 201 of the Prevent Pandemics Act. Our amendment would include a non-competitive set-aside for tribes, tribal organizations, urban Indian organizations, and tribal health departments to apply for the Prevent Act's new grant programs to address the social determinants of health, to reduce health disparities. American Indian and Alaska Native people experience worse health outcomes when compared to non-Hispanic white Americans. They have a life expectancy that is over 2 years less than non-Hispanic white Americans, and they are more likely to be impacted by chronic conditions and other diseases. So this is certainly driven by the social, environmental, and economic influences of health. And it's also driven by a lack of resources, which prevent tribes from being competitive in accessing funds from very well-intentioned federal grant programs like we're establishing in this legislation. So this would be a new program intended to address upstream factors that contribute to negative health outcomes, and it only makes sense to include a non-competitive set-aside for tribes. I appreciate very much working with Senator Murkowski on this, and I urge my colleagues to support this common sense amendment, and I will request a voice vote on this.
Any
Madam
other?
Chairman?
Senator Murkowski.
Madam Chairman, I appreciate the leadership from Senator Smith on this issue. She's described it well, and the reason why, the rationale for this set-aside. I think we all need to keep in mind the federal government has treaty and trust obligations to provide quality health services to all tribes, American Indians and Alaska Native peoples. When it comes to COVID, we saw that American Indians, Alaska Natives, were some of the hardest hit by the pandemic. COVID-19 exacerbated these underlying health conditions that Senator Smith noted. Native individuals were 3 times more likely to be hospitalized for this virus. And so, again, everything that we can do to focus on not only the pandemic itself, but these health disparities that exist. We've got to remember that whenever we are dealing with public health legislation or any health care that Congress is going to pass, whether directly or indirectly, it's going to have an impact on the Indian Health Service. And so I think it's important to ensure that when we have new programs that we look to how we ensure that our Native people are appropriately accounted for by including dedicated funds. So I appreciate the chair and the ranking member and the work that you've done already to ensure tribal priorities are included in this package. But I do think that this 5% set aside is appropriate and needed, and appreciate Senator Smith's leadership.
Any other comments
Madam
on this
Chairman.
amendment? Senator Burr.
Madam Chairman, I'm not going to stand in the way of this vote, but I just want to make clear to my colleagues who are authors of it, this totally ignores state-recognized tribes. I mean, once again, if you haven't gone through the federal gauntlet, you get cut out. And we've got state-recognized tribes out there that are desperately trying to get federal recognition and deserve it. Yet there's little interest on our part at doing the recognition. We just want to continue to keep the pie tight and split it up with those that are recognized. It's not going to last forever. But this is an appropriate thing to do. I just wish the pie were bigger.
Madam Chairman,
Senator Murkowski.
if I may just give the assurance to the ranking member, as the ranking member on Senate Indian Affairs Committee, know that we hear you very much. We recognize that there have been political considerations, but it is my hope and my desire that we finally resolve this for the Lumbee people. You've been a strong advocate there.
Thank you. I'll just say that I agree with Senator Smith. It's really important that we make sure that federal resources are allocated specifically for Indian tribes and tribal organizations, urban Indian organizations, and tribal health departments. I will support this amendment. Any other comments on this?
Madam Chair, I'd like to thank the chair and the ranking member for working with us on this amendment. I appreciate very much what you're saying, Senator Burr, and look forward to continuing this discussion. I also serve with Senator Murkowski on the Indian Affairs Committee, and I hear what you're saying.